My name is Lexi Contreras. I'm a fourth-year PhD student in the Department of Social, Behavioral, and Population Sciences here at the Celia Scott Weatherhead School of Public Health and Tropical Medicine at Tulane University. I'm joined today with the wonderful assistant professor, Dr. Julia Fleckman, and she is also the Director of Research and Evaluation at the Violence Prevention Institute here at Tulane. Hello.
Hello. Nice to see you, Lexi.
How are you doing today?
I'm good.
Well, thanks for taking some time to chat with me about your public health journey.
Yeah.
First, just kind of wanted to open with how you entered this wonderful field.
It's a good question. I had a sort of a long, not necessarily linear journey to getting to public health. Many years ago when I was in high school, I started volunteering with a youth development organization that did youth development, community engagement work in Latin America, and became very, very passionate about that work and worked and volunteered in that organization for many years. Did a lot of international development work. And I think there I really became interested in particular with more social and political determinants of health, and actually didn't quite have the name for public health at the time. This was really before the public health field had kind of taken off the way it has now. And in college studied political science, but I think realized that wasn't necessarily the career trajectory I wanted, and slowly found out about public health and continued working in international settings. I was really, really interested in youth development work, sexual and reproductive health in Latin America, and did a master's at the University of Texas. And I think over time became really, really fascinated and interested with how we improve health outcomes at the population level and how we improve social outcomes at the population level, because they're so intimately and directly tied to even more physical health. Yeah.
You mentioned that your path kind of in public health wasn't linear.
Yeah.
Can you tell me more about
Sure.
what that timeline looks like?
Yeah. I think that before I really had a framework for public health and understanding what that is, I knew I was really interested in this type of work. And, I think I wanted time to kind of figure out if that was really more practice-based, if that was maybe more in international settings, more local settings. I do community organizing work as well, and I've always been deeply passionate about that. And so the local context was something that, I really wanted to consider, and actually have really shifted to doing, over time, more local work. I think when I started my master's, this was a few years outside of college. I did work for a few years after college, and that's really when I figured out, okay, I want more of a structured, educational setting to learn more about public health and to think about this in a practice setting. Never thought I would do a PhD. Went to do that, really figured out, I think, more of the deeper connection between, local community and community organizing work and public health. And actually, after a series of just, I think, opportunities, working with some faculty at the University of Texas, and getting more intimately involved in the Houston community, I just really found a passion for research, and applied research in particular, and how research can really inform practice and policy, and really thinking about sustainability. So actually made the decision to keep going, and applied to PhD programs, and really found my passion there. Yeah.
I know it looks like you did a lot of different kind of touch points of public health, some social stuff, some international health. What did you end up getting your MPH and your PhD in?
Yeah, so I am in the social behavioral sciences field, but I'm interested in really two particular areas. One is really more thinking about social epidemiology and how we can use more innovative techniques to understand contexts and determinants, in particular of violence. That's where most of my research sits now. And also really intervention, development, design, and sustainability. both from like a programmatic standpoint, working with community organizations that are doing really important work to think about how evaluation can inform what they're doing, both in the day-to-day, but also just sort of in the long term, how they're improving outcomes for people. And then I think about that on the policy level too. But I think in particular, over time, especially working with young people, began to see a lot of similarities in some of those social conditions. Many of them had pretty extensive histories of trauma and exposure to violence that really influenced who they were, and how, unfortunately, how I think we stigmatize them, and the inequities in those types of exposures. And so really thinking about like, how do we influence that, creating more equitable system where where young people can thrive, and how we support even their family structures, their parents in that process too, is really where my interests are, and over time, I think I became interested in that, and then in my PhD program had the real opportunity to learn more comprehensively about how to actually do this type of research and do, both the more examination of trends and determinants, but also more community engaged and community driven work, how we develop partnerships in that way. And it's something I'm still remain passionate about now.
In thinking of like being interested in social epidemiology and social behavioral sciences, what made you pursue the social behavioral sciences over an epidemiology degree? That's
a great question. I was never just interested in more epidemiological methods, because I'm also interested in more of the evaluation and intervention, development, and design. And I think the social and behavioral sciences offer an opportunity to theoretically, I think, and conceptually understand that better, and marry the two. I think it sort of depends on where you end up too for a PhD program and the type of faculty that you want to work with and learn from. Sometimes they might sit in an epidemiology department, sometimes they might sit in the social behavioral sciences department, sometimes they might sit in the policy department. So, I guess if I had, one piece of advice for incoming students is look to see what the coursework is like, but also look and see what faculty are actually doing in that department, and does that really speak to you? Even perhaps reach out to some of them, or talk to students that are in the program so you can understand a bit more about that. Because if you're sort of sitting in between the lines of certain departments and you're having a hard time deciding, that might be helpful. Yep.
Well, I think that's great advice. Yeah, I appreciate that. Have you, for our department specifically, is there any other kind of maybe like advice for preparing to apply, who may be doubting themselves and if they're qualified?
Definitely. I think if you have a passion for this, try not to doubt yourself, but reach out and talk to people about their experiences. I think there's a good opportunity to talk to existing students, talk to faculty, get a sense of what your background is like and where you might be able to use this degree, the skills you might want to improve, how you can talk about those things. It's okay to not know it all. I didn't know a lot when I was going into both of my degrees, and still, I think it's a continual learning process. I still learn a lot, as faculty, both from my colleagues and from students, and many of the partners we work with too. So, really trying to think, more comprehensively about the types of skills you want to gain and how that's valuable to you and your, future professional trajectory, I think is important. Yeah.
I think that's really great advice. Great. Thank you.
You're welcome.
So you mentioned that you never planned to get a PhD, that research, you started having interest in that. What was that process like, applying and choosing a PhD program?
Great question. I knew that I wanted to go somewhere where folks were studying both sort of the structural and social determinants of health and really more solution-oriented, responses to those. And so, I looked around at many PhD programs, and there are a lot out there to weed through, but I think what was one of the most helpful things for me is looking, as I said, in my advice for students is look at what faculty are doing, the work they're doing, what they're publishing, the community partners they're engaged with, what their areas of focus are, and most currently, And that can be a really useful tool to kind of understand, okay, these are the types of people that I want to work with and learn from, and looking at the, some of the course offerings too. But in particular with a PhD, you're really paired with a mentor that you work with very closely. And in some programs, that's someone that you've already spoken with and engaged with prior, in the application process, or you might be matched with in the process of applying. But I reached out to people anyways because it was really helpful just to get a feel for the program, to, see who I wanted to work with, if it would be a good match, and if they were taking new students. And, in that process, I applied to a few programs that looked great. I was always really excited about Tulane in particular, which is where I ended up going to complete my PhD because of a few faculty in particular that really focused in some of the areas I was interested in, youth development, structural and social determinants, intervention development and design, violence prevention. There were folks that did that work and that I still work with today, actually. I work with both of my former mentors very closely and got a lot out of my experience here.
Awesome. Can you tell me a little bit more about what your current research is on?
Yes, absolutely. So I have, I kind of broadly described my interests, but I think more concretely, I do look at determinants of violence, and in particular, community violence and firearm violence. I also have an interest in childhood exposure to violence, so I do some of that as well. So looking at things like, structural racism and social inequalities and how those might influence violence outcomes, but also kind of thinking more broadly about things like funding allocations and how those might influence outcomes, people's neighborhood experiences and exposures and how that might influence, both their attitudes and behaviors. And then I think even more interestingly, I'm really do a lot of community partner evaluation and practice work. So I have a couple of projects right now that are really focused on community violence and firearm violence interventions in New Orleans. I really enjoy working in the local context and working really closely with partners to figure out how we best evaluate both the process of developing and implementing a particular intervention or program and what the impacts of that program might be. And then I think even more importantly, the feasibility of making something that sustainable. How do we secure additional funding for things, for those types of resources and programs? How do we integrate them into systems where they can operate sort of on their own? Those are kind of my two big areas of interest, yeah.
I think those are really important areas, and I love that local context approach and community engagement that you mentioned that you're doing.
Yeah, and I think that can apply locally, but it applies globally in many ways. I do some national work too, and I just think that really kind of thinking about community-driven work as a practice is really critical for public health.
Yeah, I agree.
Yeah.
Well, thank you so much. I really enjoyed getting to learn more about your career trajectory and how you ended up here at Tulane as an assistant professor.
Awesome. Thank you so much. This was really, really interesting, and yeah, thank you for asking.